Good morning, everyone. It's great to see Queensborough President Richards leading in terms of communication on vaccines from his office, and we are proud to join him today for this very important healthcare issue. It's good to see the DOHMH here and all the other elected leaders speaking that this is the way to go. I'm Dr. Frank Grosha, as was mentioned, President of Doctors Council SEIU. We represent the frontline doctors that are fighting COVID-19. Physicians, nurses, and all hospital staff, they jeopardize their lives to save lives. And it's important that they did this while there was no cure. Scientists were working feverishly to try to come up with a cure, something that will prevent the transmission and the severity of the illnesses from getting worse. Our doctors held patients' hands while they passed away alone in hospitals. We looked over our N95 masks and said to ourselves, what can we do? We need a miracle. We got a miracle. It was the vaccine. And that certainly, it lowered the severity of the illnesses, it prevented people from dying. It is the way to go. Unvaccinated individuals currently comprise 97% of all hospitalized patients for COVID and people that are getting sick. Therefore, currently, this pandemic is of the unvaccinated. As we approach this critical time in the pandemic response, it is so vital that the future of New York City is held in the balance of trying to achieve enough people being vaccinated to stop COVID in its tracks. We are in this together. Seriously, we're tethered together. So it is imperative that we each try our best to tell people to get vaccinated. Even my children, when they were pregnant, I counsel them to get pregnant. You know what?
He wanted to grant. He wanted to get legal age.
I have 2 grandchildren already, but I counsel both of them to get vaccinated. And that just goes to show that it's important and it's worth the risk that you think you may have. We're all in this together. If you are a Far Rockaway resident or any New Yorker, it is important to seek the information. There are places, clinics, hospitals, hotlines to call available to give you credible information and vaccinations. I'm very concerned, as others are, about the Delta variant. This variant is so infectious, and the severity of its illness shames every other coronavirus that preceded it. We have to realize that Mother Nature will throw us curveballs. It'll throw us a few sliders, some breaking pitches. I'm throwing this out there for the Mets fans in the audience that understands this analogy. To stay ahead of the count, we need to become vaccinated. This is not a political statement, as some people say. It's a public health issue, and that's what it really is. The doctors have done everything possible and have seen too many people die. The longer more of us do nothing, the worse this will get. And we may have other variants that will make the Delta variant look like child's play. We don't want to get there. Speaking as a physician, the way to go is to get vaccinated. It's very important and commendable that leaders like Borough President Richards, Adams, and the representative for Diaz Jr. in the Bronx are fighting to spread the word that this is vital. Vaccinations is the way to go. We need to listen to our constituents. We have to listen what makes them hesitant so that we could respond to them about their hesitancy. We could focus, individualize our responses. Also, we have to have the providers, the doctors that provide the vaccinations be of the same populations that their patients are, so that they look at this as credible and real responses from people that they trust. please, vaccinate yourselves. It'll help the city. It'll help the ones you love. We need to fight this and win it. Thank you.
Thank you. Next, we'll hear from a leader in the state who's worked very hard on this issue from the beginning, State Senator James Sanders Jr.
Thank you. Thank you to the borough presidents, to the fellow electeds, to the health officials, to all community leaders and everyone gathered here. It's a beautiful day in the Rockaways. However, this day is deceptive. This is literally the lull before the storm. We are expecting in October the new Delta variant to sweep through communities like this, to go back to the days of where we will have run out of space in the morgues and have to use refrigerated trucks again. This is one possibility. We have been through that. As a lifelong resident of the Rockaways, it was horrible to see my neighbors, my friends, my family, as it was stated, going into the hospital, never to come out alive. However, we have to look at this. There are those who believe that there is a conspiracy afoot, and we have to address their fears. And there are historical precedents, and these things must be taken into account if we're going to tackle this. But I urge government to go a step further. That is not the only conspiracy, I would argue. We need to look at how much disinformation is being aimed at these communities. How these communities are being targeted through the web and other sources with the most insane information out there. The Department of Homeland Services should be taking a look at this to see what we can do. It's not that these folk are less rational than anyone else. It is that they are being targeted. And we as Americans need to stand up to Russia or whoever else is targeting these people and say this is not going to stand. So I urge all of us to do that. Now to my community, I am a native son here. I don't like needles. I'm not known to be courageous at that moment. I'm known to be cowardly at that moment. I took my shots, not just once, twice. I took the shots. We have to live what we're speaking, our values. I met a man the other day, just yesterday. We were speaking and he was saying how he was on a ventilator and almost died. And then in conversation, he was saying how people don't believe it's real, and he says it's real, okay. And then he said, have you taken your shots? I said, yes. They said, good, now that gives me encouragement. I said, what do you mean? You on a ventilator, and you have not taken the shot? What is your fear? He's saying he doesn't trust it. You don't trust it? You almost died. What more can happen to you? So this is the level that we have to attack. We have to understand what is happening with people. Otherwise you're going to come up with these people are less rational than anyone else. No, there has to be more afoot here, and we need to tackle it that way. I again applaud the borough presidents, the other leaders, my leaders here. We sent a letter to the mayor, and our letter requested that every time, the present mayor, I should say, not to this present company. We sent a letter to the mayor, and I'm sure he would have done it already. A letter saying that if we have public events, we should have a vaccination truck there. Therefore, they can get it. They don't have to do. There's some common sense stuff. We just did an event in the Rockaways, close to 1,000 people. We requested the truck. It did not come. So it's not simply the Rockaways. We have to look at everything that's taking place here. Thank you, sir. They are better speakers than me, and they're about to come up. Thank you.
Thank you. I want to acknowledge we've been joined by State Committee Woman Betty Leon. We're also joined by a representative from State Senator Joseph Adabo's office, Regina, representing the Beach 41st Street Houses Senate Association, Reverend David Cockfield, Battalion Pentecostal. Next, we're going to hear from Renee Hastic-Most, the Vice President of External Affairs at St. John's Episcopal Hospital. And following her, we will hear from Assembly Member Khalil Anderson.
Thank you, Borough President. Good morning, everyone. As the Borough President and many others alluded to, St. John's Episcopal Hospital is the only hospital here on the Rockaway Peninsula, and we saw thousands of people come through our doors. We saw hundreds of family members have to see their loved ones in a dying state. It's not an easy thing. We're here today to partner with the community. We've extended our hours at our Patient Express Center to open up in the evening to, provide accessibility for people who have to work during the day. They can come at night and get the vaccine. It's really important that we understand that COVID-19 is a serious, serious virus. Me personally, I lost my father last year to COVID-19, and I had to watch him get his last rites on an iPad. It's not easy. So we have to understand that this virus is something that can take our lives. It can take the lives of our family members. It can take the lives of people we don't even know that we come into contact with every day. So accessibility is here. Again, we stand with the community, St. John's Episcopal Hospital, to make sure that people can't make an excuse that the vaccine is not accessible. It is available. Please get the vaccine. Please make sure your children are vaccinated. Let's live healthy lives, and thank you.
Thank you. Next, we'll hear from Assembly Member Khalil Anderson.
Good morning, everyone. Good morning, and good morning to Edgemere. We're here in Edgemere, in the Edgemere community. I'm frustrated that we're in a space where we have to continue to remind folks how critical and important it is to get vaccinated. We've lost so many lives here in the epicenter of the COVID-19 pandemic here in the Rockaways, but it's so important that folks understand, right, the root of why folks are hesitant, the root of why folks are fearful, right? Medical racism that has existed in our society for generations. It's important to acknowledge that. It's also important to acknowledge the disproportionate access to health in our community and health services and resources in our communities. But it's also important for us to call on our community to do the right thing and to get vaccinated. To stop using spaces like the Shade Room, Instagram, Twitter, Snapchat as spaces of information where we have experts who can provide that information-based knowledge. So it's so important that if you want information about the vaccine so that you can make the best possible decision, reach out to your electeds, reach out to your community leaders, reach out to the groups and folks who are doing the work on the ground around this vaccination so that you can be the best informed. There's no microchip. There's no, third world conspiracy. Get vaccinated to help protect our communities so we can get back to a somewhat normal life in society, so you can enjoy the regular, normal activities of your everyday life without having to wear a mask. It's very simple. Get vaccinated. A lot of folks are also fearful of the different types of vaccines. Well, guess what? There are 3 different types of vaccines. So if you're fearful of J&J, you can get Pfizer. If you're fearful of Pfizer, you can get Moderna. There are many, many different ways for you to get vaccinated. Our offices have been on the front lines and educating people and doing information forums with experts from St. John's, experts from the Adabo Family Health Center, experts from HHC, and that's going to be key, critical, and important to moving our vaccination rates to where they need to be here in Edgemere and all across the Rockaway Peninsula. So the message is clear. Get vaccinated. No pseudoscience. Get vaccinated. Thank you.
Thank you. And I like that you alluded to the folks, as our state senator did, who have PhDs online, the player-hater degrees when it comes to the vaccine. Please stop your nonsense on these Rockaway websites, spreading your nonsense. We appreciate you being a street doctor, but let's actually listen to the folks who know what they're talking about. I want to also acknowledge we've been joined by the Far Rockaway NAACP, and we now will hear from Councilmember Savina Powers.
So good morning, everyone. Thank you to my borough president and to our fellow borough presidents across the city for coming out here and standing in solidarity with the Far Rockaway community around such an important issue. Since the start of the pandemic, Rockaway has been one of the hardest hit communities. And in the beginning, we were fighting for access to testing sites. Then it became access to the vaccines. Now, that is no longer the page we can read from because there is now access. We have been diligently working together to ensure that we have permanent sites and mobile pop-up sites to meet you where you are. And I understand, especially coming from an immigrant household, what some of the myths are, and sometimes in Jamaican culture you may hear you could draw your tea and you'll be okay, right? This is not the time for that. My mom has even received the vaccine. I am a mother as well, and I'm a nursing mother, and I've decided to go ahead and I got the shot as well. Recognizing that we're at that point with this Delta variant that I don't want to risk my family's safety. And I think we have to come to a space where we are not thinking selfishly and thinking about the people in our homes that we come across. When the vaccine became available, I remember hearing from so many seniors that wanted to get vaccinated because they just wanted to hold their grandchildren again. They just wanted to be able to be around people again. And right now, the Delta variant threatens to bring us back to where we once were. And from the very beginning, I have said that the road to recovery will include this vaccine. The road to recovery will be rested on the community's response and what we do as a community to keep ourselves safe. And so as new mandates are coming out, I do not want our community to be shut out. And so I encourage people, go call 311, find the nearest pop-up. Every day there is a new pop-up across the communities in the city, especially here in Rockaway. We have 3 permanent sites, one at each of the Joseph P. Adabo Family Health Centers. We also have one right here on Beach 39th. We have St. John's Episcopal Hospital that also is offering the vaccine to the community. So please, let's move away from trying to weigh out what's going on. We've heard from the professionals already, and this vaccine is our best option in defeating the Delta variant. Thank you.
I had a youthful moment. Renee, did you speak?
Yes.
Okay, all right, got it.
Just a moment.